Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Do you know someone who recently gave birth and for some reason they seem like they're not themselves, their usual selves anymore? There may be a reason for that. Today's topic is postpartum depression on WHAR with nurse midwife and GYN provider Patsy Harmon, partners in women healthcare associated with Mon General Hospital. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, Jim.
Good morning, Patsy.
Good morning, Jim.
Welcome back to the program. And I know this is a very serious issue. And, you know, anytime we talk about depression, it's a serious issue. But postpartum depression is depression after giving birth, right?
That's right. Actually, 1 in 4 women will have some postpartum depression. We usually call it the blues. I think people didn't used to think it was all that serious at first. You know, oh, she's just going through a transition. But when it lasts for longer than just a week or so, then we believe it is a real serious depression. And it can happen any time that first year after having a baby. I used to think it would be something maybe like the first 3 months, but I've seen women come in at 6 months and asking for help, really, and not even knowing that it was an actual hormonal thing, thinking, you know, there's something wrong with them.
That's what I was going to ask you, if it was hormonal, because the body, woman's body goes through so many changes, prenatal, during birth, and after birth.
That's right. And when you're pregnant, your estrogen levels are extremely high, so the drop can be profound. And I think sometimes it's almost like going through menopause in a week. You know, Kay and I would know what that's like. But, you know, you even see people get hot flashes and things like that. But the reason I wanted to talk about this is exactly what you say. You know, not everyone is planning to have a baby. Not everyone is pregnant or a mother or father, but we all know somebody who is. And that's why people need to know about this disorder so that we can be helpful to the family when we see something going wrong.
And what does the lack of sleep and all at once the realization of, wow, I have this huge responsibility in front of me, maybe I'm not getting a lot of support from the husband and the family, so does that play into any of this at all?
Oh, absolutely. And I think we used to think that was it. It was a lack of support or a lack of sleep. Now we know it also has to do with hormones.
Combination.
Yeah, it's definitely a combination. And, you know, just when you're most vulnerable, like you said, you're tired, you're getting up every 3 hours to feed the baby, you know, you're just not getting a decent night's sleep, and you're maybe a little anxious. Whether you've had kids or not, every baby's different. So all those things work together. And there are certain vulnerabilities. Some women are probably more vulnerable to this than others.
Have you noticed if it is more so for the first time we're a mother or the second, third time, or does that make a difference at all?
I don't think that really makes a difference, because when you think about it, say a third-time mom, you know, you figure she's pretty experienced, but she also has 3 to take care of now. Mm-hmm. And sometimes they're close together. You know, you could have a 2-year-old, a 4-year-old, and a new baby. So I don't think that really makes that much difference.
What about age? Does age play into this at all? Being a young mother or being a more mature mother?
I don't think so, Kay, because, you know, nowadays women are having babies at 39 or so.
Who are really ready and want that responsibility.
Yeah.
That's why I asked that question, because sometimes when we're 18, 19, 20, we're having that baby very early in life. It does seem overwhelming, and maybe we hadn't even planned on it. And
that's absolutely right. You know, in the best of both worlds, I mean, all worlds, we would, you know, every baby would be planned, but actually I think I read somewhere 90% aren't planned. That doesn't mean they weren't welcomed. It just means they weren't planned right now. But the thing is, even older mothers, you know, sometimes they can be professionals and people who've had a lot of control and responsibility in their lives. Babies don't work like a corporation. You know what I mean? And so those women actually, I think, are just as vulnerable as, say, an 18-year-old who doesn't know very much, you know, maybe got pregnant by accident. I had someone just the other day, you know, as a single mom at 39 by choice, and it's overwhelming to her, you know, just like it would be to a 19-year-old.
Yeah, because if postpartum depression is related to hormonal changes don't know your age, really, do they? Or does your age affect how your hormones work?
No, I think you're right. Hormones don't know age. There's a lot of things involved. I mean, some people have had a history of depression, and if you have had a history of depression, you're a little more vulnerable, I think. But it can come out of the blue, and I think that's what's so disturbing to mothers is they just didn't see it coming. And most people feel a sense of guilt, like, I should be happy. Look, I got this beautiful baby. It's so cute. Everyone says how lucky I am. And yet I feel terrible. I just feel like I'm down in a pit, and I can't see how I'm going to ever get out of here.
About 18 years will do it.
18 years.
So if there is a history of depression, I mean, can't you treat that? I don't know if you can treat it while carrying the baby, and can't you foresee that and perhaps treat it before it happens?
Yes, you can, and that's one of the things that care providers should be alert to, but they don't always get around to asking questions like that. Nowadays, we try not to have a pregnant patient on antidepressants. So there's been some complications noted, not huge ones, but we try to not have people on Zoloft or Paxil or Prozac, those kinds of medicines, unless the woman is in real bad trouble, then you can be, but we try not to. And so after the birth, really the provider should be asking, or really ideally during prenatal care, you would want to find out if a patient had this kind of history so you could be prepared to help her. And you're right, you could put somebody on antidepressants after the baby is born as preventive medicine.
And our guest this morning is Patsy Harmon, and I wanted to mention that she's also an author, as well as being a nurse midwife and gynecologist provider. The author of The Blue Cotton Gown and Arms Wife, is that?
Wide
Open, okay. And Midwife's Journey. So there's all kinds of information in there. Oh, you saw the typo just now?
I see the typo, yes.
So she's also an author as well, and her book's available online and in bookstores. If you have any questions about postpartum depression, pick up the phone and give us a call at 304-296-0041.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Welcome back to Health Talk, brought to you by Mon General Hospital on WAJR. The topic today is postpartum depression with Patsy Harmon. She's a nurse midwife, and your phone calls are welcome at 304-296-0041. It is hard to understand on the outside looking in the most joyous thing in life, giving birth. A woman, you would think at that time, is just at the height of her life. But when she has postpartum depression, for those on the outside, it's hard for us to understand why, right?
Well, that's for sure. And I think that's one of the things that causes women to feel a sense of guilt about this, that there's something wrong with them. And it complicates getting treatment for people that we care about, because they hide how badly they feel until they really start to deteriorate. There's some things that families can be watching for, and friends, and one of the things you'll see is a woman will stop taking care of herself and maybe just do the minimum for the baby, but kind of loses interest in the baby. Sometimes people report, that she just doesn't even get dressed that day. She walks around in her jammas or a robe, and if she wears makeup, she stops, taking care of that. Maybe stops washing her hair. I mean, these are things that really happen to people who are totally put together at other times. So the reason I want to talk about this is just because I'm concerned that there are women out there who may be suffering right now, and that there is a possibility for help. And I do hope, people will call in if you have questions, or if you don't think of it right now or you're not able to, you can call my office. It's Partners in Women's Healthcare, and the number there is 599-6811. We might be able to send some literature to you, or just, maybe give you some advice if there's someone that you're worried about, or the woman herself could come and see me if she wanted to.
And when they do, what are you going to do for them?
Well, it's interesting. Since hormones usually are the culprit, one of the things I would do would draw her labs and find out how her hormones are. Certainly an antidepressant, some kind of medication.
If they're breastfeeding, can they take that
Some
type of a
medications,
medication?
yes. And sometimes I've had patients have to make that choice, which is hard for women who are devoted to breastfeeding. But if they're falling apart, sometimes maybe you just have to offer formula so the mother can get herself back together and get the medication that she needs.
And if we could just remind family members that if your loved one, if your daughter-in-law's had a child, if you just volunteer some time, I'll come over and spend 2 or 3 hours this afternoon. You just go shut your bedroom door, lay down, and get some rest. If you could just express that enough to tell people to extend that to their loved one and help them through that time. We may not get to that position.
That's exactly right. And you want to start making those, generous offers early before the mother gets so exhausted or so depleted that it's almost like their brains are wired. Like I had another mother this week who just, even when people are there, feels she can't sleep. It's like she can't turn her brain off. And I guess it's just gone too far. But, if people stepped in like that a little earlier,
Makes
and
such a
sometimes it's
difference.
inevitable because it is hormones, right? You could have, tremendous support from the husband, from the grandparents, and this still might happen. But we want to do the best we can for our loved ones early, not after they start to get sick.
From a man's point of view, what are those signs that I look for that my wife is perhaps in this stage of postpartum depression?
Besides staying in her pajamas.
Yeah, I mean, is
Besides,
there
that would be-
appetite change, just not wanting to socialize? I mean,
Yes.
talk about some of those things.
Some of the things that you might see would be change in appetite. Women just don't have an appetite, just like a really depressed person, because they are really depressed, right? They just don't feel like eating. I guess it would be possible that someone might start eating who hadn't been that kind of an eater, but usually they just don't feel like eating. They sometimes will have a difficulty making decisions. You may see, we call it postpartum depression, but it could be postpartum anxiety as well. And I've seen patients who have irrational fears. They keep thinking they're going to drop the baby. Well, they're perfectly strong. It's nothing wrong with their arms. Why would you just drop your baby? But they become very phobic about these things. Or think that the baby's going to die in its sleep, which, SIDS and, sudden infant death is a real thing, but very, very uncommon. So all those kinds of things are what you might see. Just a feeling of disorientation, like she's just not herself. I think those are the kinds of things that you would be watching for.
And you may see a reaction, as you talked about, in just not feeling that close to the baby, not embracing the baby the way we should. That could play into it as well.
And mothers will often hide that. Later they'll tell you, I just didn't feel a connection, and I felt so ashamed that I didn't have this sense of love. And what's going on in the person's head, they're often not verbalizing at all. That I'm worthless, that I don't deserve this baby, that I might as well kill myself. And that's where you start getting into what we call postpartum psychosis, which is much less common. Really, they say it's less than 1%. Usually something like 1 in 1,000 women, really will go so far as to harm herself or attempt to harm herself or harm the baby or another child. We've heard of these terrible, terrible situations on the news in the past.
Alcohol doesn't solve anything.
Alcohol does not help. We know that it's a depressive as a chemical substance, so that would be a bad idea to start having a cocktail through the day just to get through. And again, probably women would hide that.
Are new moms prescribed any kind of painkillers or muscle relaxers afterwards? Because those can become addictive as well.
They can, and cesarean section is so common anymore. 1 out of 3 babies is now born that way in the United States, and they would be given some kind of Percocet or something like that after the birth. And I guess that's something a care provider should be alert to, or the family, if if the woman is asking, saying, I'm still in pain, now it's 2-3 weeks, I need some more Percocet, because that can blunt, it helps with pain, but it also blunts your emotions. So if you're hurting inside, maybe, you might feel it helps. Not a good idea, though.
We cannot get through a health show without mentioning nutrition, healthy food, and exercise. Would that play into any of this?
Well, I think it's very, very important, and this is where the family can get in there. Making sure that bringing casseroles over, making sure that the woman is getting good nutrition, making sure she continues her prenatal vitamins, lots of fluids, just like pregnancy, and getting out of the house is so important. Like you said, Kay, if someone could come over just for a while, either to let her sleep or let her get out and get some fresh air. Go walk around at the mall and look at other people, because there is that sense of isolation if mothers are at home all the time. And I want to talk about one other thing, which is postpartum depression for fathers. Now, this is something you wouldn't think about, but people who are doing research, it's not as common, and it's probably not hormonal, but men can also go through some of the drop. You're very elated during the pregnancy. Oh, we're going to have a baby. We're so excited. And then afterwards, the reality can hit you kind of in the face. And some dads actually do go through a period of postpartum depression during that first year. This isn't the kind of thing an OBGYN or a midwife would probably pick up on, because they don't come in for a postpartum check. But families should be alert.
It probably manifests himself. Maybe he's afraid to hold the baby or pick up the baby.
Different things like that.
Afraid he's going to break the baby and
Right.
those types of things. So.
And maybe he feels like the mom's attention's all on the baby, while before maybe they were kind of fun, loving couple. Now he's kind of out in the cold.
It changes.
Yeah.
We're talking about postpartum depression today, and your phone calls would be welcome at 304-296-0041.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Patsy Harmon is our guest this morning, and again, she's also an author as well as being a nurse midwife. The Blue Cotton Gown and Arms Wide Open, A Midwife's Journey, available online and in bookstores. And we're talking about postpartum depression today.
Yeah, we're going to tell you how to get help here in just a moment and where to go for help. Before we do that, Patsy, give us a rundown. How are we going to know if we're depressed? Tell us about perhaps some signs, or where can we get a list to say, wow, I have about 3 or 4 of those on the list.
Well, I imagine most doctors' office has something like this, but at our office we have a depression symptom checklist, and if anyone would like one, please just call the office. It's 599-6811, and a nurse or I will talk to you and send you out a little checklist so that you can think about whether this might be you or someone that you care about. Things when people are, even if you aren't sure, you just think maybe something's wrong, I hope people will go back to their care provider. If you don't have one that you feel comfortable with, please call me. It's just very important, and there's things that your care provider can do to help you. Some of the things that I would do is to get your labs, to talk to you about your situation. Are there people that could be helping you more that maybe you just haven't reached out? And then to think about medications, whether they be hormones or an antidepressant. It's a very serious problem, and we want people to get some care. One of the things I've noticed is that we don't do postpartum checks until 6 weeks. So between having the baby and 6 weeks return to the office, things could be going downhill. And please, if you notice something like that, don't hesitate to go to your provider at 2 weeks or at 3 weeks or 4 weeks.
And as you said, most people will have this checklist, or they can come into your office.
Right. Just come to my office or give us a call, and we can mail one out to you. We'd be happy to help.
Your phone number? Or?
The phone number at my office is Partners in Women's Healthcare. It's 599-6811. It's in the phone book. You can find us.
And in the meantime, in those 6 weeks you talked about that perhaps they should be checked, but multivitamins, lots of water, those types of things are important.
And nutrition, good nutrition, and that's where the family and friends can pitch in, making sure that the family has good food in the refrigerator there. We can bring it into them.
And if we buy one of your books, can we somehow get it signed by you?
You can come to my office, and I'd be happy to sign. Just tell the people up front that you need your book signed.
All right. Thank you so much for
Thanks a
being with
lot.
us today. Again, Patsy Harmon, nurse, midwife, and gynecological provider. Is that right? I mean, you just have GYN provider, but
GYN is fine.
Okay, GYN provider at Partners in Women's Healthcare associated with Mon General Hospital. And again, videos of these programs that are on WHAR every Thursday morning are eventually on the website at mongeneral.com. So, yes, you can see Kay and I hosting the show and talking to various guests brought in by one Greg Keeley with Mon General Hospital.